Hello, everyone. Welcome to our first Friday event of the semester. I have the pleasure of introducing our guest speaker today, Dr. Randy Bergman, who got his doctorate in human ecology from the University of Tennessee in Knoxville. He also possesses a certification in health ed, a specialization in health education. And he is an associate professor of public health here at Lenoir-Rhyne and is also the coordinator of our master's in public health degree. And under some duress is our chair of our institutional review board, our IRB here at Lenoir-Rhyne. He's going to be speaking to us, as all of our speakers have the semester, about the impacts of the pandemic on our day-to-day lives. Please join me in welcoming Dr. Bergman.
Thank you, Dr. Newton. Thank you for the invite to do this as well and to talk to you about some research that we conducted last year on LR's campus, looking at COVID impacts over a full academic year and how we connected that to quality of life. I will tell you all, there might be a little reminiscing about the year 2020, and that might bring up some, I don't know, PTSD, bad fears, worry, whatever that might be as we go back. Actually, as I was putting this slide together over the last couple of weeks, I had to refer back to some notes and be like, wait, when did that happen? And what happened when that happened? And was that actually 2020 or 2021 or whatever it was? So I might need some help as we try to recollect on some of those things. And again, just talking through all of the stuff that took place and how that impacted not only the students, but our survey also looked at faculty and staff, okay? And the work that I did here is with Dr. Hall. He's a colleague of mine down at Florida Atlantic. He is in health promotions. He and I actually went to Tennessee together, got our doctorate together, and we've continued to do research back and forth, sharing resources. He does most of the statistical part of that and has other resources that I don't have. And so that we compare those or use those things back and forth. All right. So to get started, if you remember back or try to remember back, does anybody recall when the first case of COVID was in the United States? It was 2020, so it was January 20th, 2020. All right, Washington State is actually from a test of on January 19th or January 18th. All right, and then came back positive on that. All right, so this is the time frame. Almost 2 years ago is when we first had that first case. If you are interested, and we do a lot of this in public health, we like to go back and look at disease spread and timelines and all of that. The CDC has done a fabulous job with this. So they actually have the museum is closed, by the way, you can actually go there in person, but they put this timeline together that marks every single COVID event. So again, when China first reported it, how it went through, where it came in the World Health Organization. We're not going to read through all of these, but you see all of these events of what actually happened. So I got stuck reading this probably longer than I should have, trying to be like, oh, wow, that happened then. That was, again, 2 years ago when we had these discussions, all right? And then also the CDC, oh, I lost my cursor, there it is, has a data tracker. And these are interesting. You can actually just Google, and Google actually pull part of this up as well, of just COVID rates. So this is what I want us to think through of when we did our survey, and you'll see this, we started our survey in the fall of 20 and did the whole academic year of the fall of 20 to the spring of 21. So to understand what the numbers looked like then, okay, and try to, again, remember back how you were feeling, what you were thinking, what we were going through, et cetera, et cetera. So you see, you can run the cross here. This is the number of cases. It gives you the common line. But if we just look at the numbers there. So December, let's say right around this time last year. Oh, where am I? December 28th. So there's the 3rd, right? Oh, go back one. New cases were at over 200,000 with an average just 175,000. All right, so we were dealing with a lot of this. You see the peak is yet to come, all right? And then we valley, and then we, again, continue through. So when we look at these numbers, we've kind of got used to this reporting at this point. And even now, do you see it? If you look at it now, this doesn't really get reported. It used to be right then we were reporting daily, right, on the news. All right, every morning, if you turned on the news, turn on the radio on the way here, any podcast, whatever, constant information about the number of deaths, number of cases, closures, et cetera, et cetera, et cetera. All right. So again, trying to frame back, I hate bringing all this stuff back, right? Trying to frame back of what was going on when we were looking at this and what we didn't know. Okay. And also, if you remember, and we don't want to, in March of 2020, University of Washington was the first university in the United States to close out for the rest of the semester. All right, they did that on March 7th. Okay, right before their spring break, I believe, and they decided that it was time to stop the spread of this disease, etc. About a week later, LR made the decision to not come back after spring break. Okay, we remember all of that. We remember what, oh goodness, what we're going to do and what is that going to look like, etc. I'm gonna say I would say it's a privilege. So I'm also on the task force here, the COVID task force. So some of these conversations leading up to those decisions were pretty intense on trying to figure out what that would look like, how that change would happen, what would happen academically, financially, politically, socially, etc. I mean, you name all of those things, psychologically, mentally, all of that. So again, I can't believe that was, again, March of 2020 wasn't that long ago, but if you remember, like, wait, we're not coming back and we got to finish out the semester and what does that look like and move students out. Then we go through the end of the school year, we get through and we're all having those conversations over the summer on, so what is the fall of 20 going to look like? All right. What are we doing? All right. And August 6th, LR releases the policies and procedures of what academic year 2021 is going to actually look like. All right. We then, as a faculty, had a meeting with Dr. Witt, discussed all of those things, informed the students, figured out what that looks like. Do you remember the block schedule? Remember how well that went? Yes, right? Okay. Those are all things that we were going through in the fall of 20, and then obviously into the spring of 21. The reason I reference all of this is some of the stuff we knew prior to those things happening, okay? We knew from studies out of China that there was a lot of anxiety, stress that were happening on college campuses and in the general public just because of COVID. So these were the first studies that were coming out in May of 2020 saying, hey, college students are struggling with these things. They have high anxiety. They don't know what's going to happen. All right. They're also struggling with depression. All right. Transitions, social changes, all of those things that are going on during the pandemic because of a lot of the unknown, a lot of social structure issues, you name it. All right. And then again, in 2020, this was closer to May. I think it came out in May as well. A cross-sectional study of 2,000 US college students looked at, that depression for those students. All right. So what this did is got me thinking of, well, what is this going to look like as we move into academic year 2020? All right. And then when August came around and our policies came out, I was like, oh, we got to figure out what this is going to look like over the long haul. All right. Because all we're seeing here are these cross-sectional studies, these one-time deals of, yeah, we know this is a problem, but I want to see how things worked over a time span. So we put this plan together. I talked to Dr. Hall, said, hey, what do you think of this? Do you think we can do this both at my institution and your institution? What is all those things considered? How does the IRB work on his end? Okay.
Share the screen.
Oh, I haven't been sharing the whole time. That's my fault. There you go. All right, thank you, sir. I apologize for that. No, it's all right. We've only been doing Zoom for how long now? Right? Yeah, right. Yeah. Okay. So looking at these cross-sectional studies, came up with the idea and this purpose of we need to look over this at a longer period of time. And I started thinking this over the summer, and then when LR released those policies in August, I was like, okay, yep, that's gonna cause some problems. And if you notice at the studies that we're looking at cross-sectional, I said they didn't consider the faculty and staff, but they didn't look at the faculty and staff. And I wanted to add that component too, because I'm one of them, right? It's how does this affect me? How does this affect my colleagues? Because we're delivering this to highly anxious or possibly highly anxious students, but we might be highly anxious ourselves, okay? And it makes sense in all the talks that we were having before this. You could feel the anxiety, you could hear anxiety, but just because you can do those things, we need to be able to measure it, okay? To see if this is actually happening and what that level is, and how do we then counter those things. So we wanted to look at undergraduate students and then faculty and staff. And I did just undergrad students because they're residential students, and LR has graduate students, but some of them are more removed. And I wanted to focus on stuff that LR could do for residential students or undergrad students on one campus. Because if we, as a community, start looking at all of our campuses, they're all three different. And so this is something we can expand upon later, all right? So we put this plan into place is to try to survey 4 different times throughout the academic year. The first survey going out in August. It was supposed to go out, and I'll talk about that in a second, a couple weeks after the policy and procedure announcement, but 1 week before school started. Do it again at the end of the semester, and then pick it right back up the first start of the spring and at the end of the spring term, all right? And then we used the general anxiety disorder, so the GAD-7, to look at anxiety levels in individuals. And we compared that with, we put that under the framework of quality of life. And then we also looked at other questions about how does your performance, how do you feel that your performance has been affected by the decisions of the university? How do you get along with others? Do you have someone to talk to? All right. And not only your work things, but can you actually take care of things around the house? Okay. And again, for students, that's going to be framed one way. Faculty and staff, that was framed a different. So we had 2 different surveys. If they clicked on a button for student, it would take them to a certain set of questions. If it clicked on for faculty and staff, take them to another set of questions. The other thing is, well, it says there was 4 data points. So August, November, January, and April. Our first survey in August asked them to think back to before the pandemic actually started. Right, excuse me, not before the pandemic actually started. Well, and back to before your university went online. So that March kind of deadline. So trying to get that hey, all this stuff has changed in your academic schedule. How are you feeling back then? Okay. So we actually had 5 different Gad scores for the data points. All right. Other things we looked at sex as just male, female, living conditions, living at home, living in the dorms, who you were living with. Did you know someone that had or has COVID? Again, remember, a year and a half ago now, not everyone knew someone that had or had, and maybe you don't know anymore either, okay? Excuse me. And that might have changed your perception or stress level on how bad or not bad COVID the infection actually was. And we also want to look at some behaviors. all right? The three W's, the face coverings, sanitizing, washing the hands, looking at social distancing. And like I said, do you have someone to talk to? And were you able to talk to that individual? And the last thing, going back to that, has the university's response, university's decision to change things into this block scheduling, online delivery, hybrid model. Do you think that's going to affect your either work performance and or your academic performance, whether we're looking at it is? Okay. Any questions to this point? Okay. So all of you know how fun research is. And what you might not know is dealing with surveying students and we have to, here at LR, we have to ask for permission to get access to students' email address. Okay. And how that process works is basically we ask the Office of Academic Affairs if we can have access to it, and it gets sent out through the Office of Academic Affairs. So, like I said, one of the first surveys to go out before the school year actually started, but that basically wasn't allowed. The provost and the president didn't want to increase anxiety by students coming back to campus by getting a survey about anxiety levels. So we weren't able to get pre-class. The survey actually went out in September instead of August, about 2 weeks after the semester started. So I was a little disappointed in that, but that's within the grounds that we have to deal with. So again, the data point was a little off from where we were hoping to have it from the start point, all right? Oh, I hit a button and now I can't. All right, so yes, there it is. Yeah, Finding Nemo. Anybody? Finding Nemo, right? Or Dory, I guess, depending on where you want to be. But that's from Finding Nemo. I believe that's Bruce. Yes. Okay. All right. Good deal. I know all my facts there. So what did we find? What did we actually look at, and how did it all work? We were really excited at that first data point to have a really big sample size, and trying to figure out how to manage that, to be honest with you, and what that would look like. So, but we did notice over time that our sample size declined. So the first couple, again, we're very happy with. Even the third one, happy with. Fourth one, we wish we had had more with that. I can tell you this, and this is very typical for, at least for health surveys, our ratio female to male was pretty skewed. For example, for students, for the first data point, we had 543, 394 of them were female. Okay. For faculty and staff, we had 170, 116 of them were female. So again, we had some skewed, and that's true for all of those data points when we're looking at male-female comparisons. All right. We've been playing with this. We haven't gone through all of the analysis that we want to, because we start finding different things, get sidetracked, to be honest with you, with academic life and other things, and try to figure out which way we want to continue to go with this. Okay. So we do know from what we have looked at so far is students did report significantly higher anxiety than faculty and staff. Sorry, and I should have said faculty in there at each one of those data points. Okay. And only 0.4, so our last spring of 21 showed significantly higher anxiety scores for both students and faculty. Okay. And this is the point that gets interesting for us. When I say it was statistically significant, yes, but if you just look at the numbers, and I wrote these down to kind of give you kind of the means, I didn't put them on the slide. So with the Gad scores, it's 0 to 21, okay? And from what I understand, this is where I had to do my research a little more. They have different cutoffs for those. So you answer 0 to 3 on all 7 of those, and then you get scaled out on that GAD scale. Okay. So we had student means for for event 1 at around 10. Okay, which is moderate anxiety. Okay. And then for faculty and staff is around 7. Students stay around that 10. They went to 9.5, 9. Faculty and staff stay right around that 7. They go to 7.5, 6.5. This 0.4, everyone jumps. Students jumps to 16, and faculty and staff jump to 12.5. So we're now, for students, looking at severe anxiety. Faculty and staff are over the moderate and heading to the severe part. And this is the part Dr. Hall and I have been trying to wrestle over of what happened. So trying to think back of spring, what was going on, and again, if it was just for students, okay, I might come up with a better reason, but to have both groups, this has been the most interesting finding of seeing that jump at that 4th point. Because my thinking originally, as I was doing this, is like, oh, we're just going to get used to this. This is going to be the new way, dealing with masks, all this stuff coming out, policies, mandates, etc. People are going to, yes, still have some level of anxiety, but it's going to kind of decrease as it did with 0.2 and 0.3. So when we looked at this and saw 0.4 jump, it was kind of like, wait, let's go back and start thinking through what happened in the spring. All right. And this is where I'm going to be honest and need your help, because we haven't quite figured this out yet. We're still also trying to come up with, do research on what other people have found to see if they've seen a jump or if they've seen trends this way. I don't know. We were discussing this actually yesterday, because I called him talking about this presentation, and I was like, what do you think it is? He's thinking more of policy mandates, and that becomes the norm. All right. And students and faculty and populations trying to just deal with this. I was thinking, it was like, wait, when did vaccinations had coming out, right? Like, I was thinking more of transition from school life to how am I going to deal with this at home, right? What does that look like we had it we did fairly well as a university, in my opinion, over that academic year with the number of COVID cases and handling that. So we had some security. And I think that's why, in my opinion, again, I haven't seen what other research has found at other institutions. But okay, yeah, we're doing pretty good. We figured this out. We've gotten used to this, and now we're going into life change, because we're going to be leaving in a couple of weeks to go home for the summer. As faculty and staff, we're not going to be here on campus. So again, vaccines out? Yes, sir. Oh, that's true, because we have some other confounding variables.
Randy, could you repeat that question for us? The one microphone did not pick that up well.
Yes. So Dr. Quinn mentioned the idea of around finals and what that might look like, as well as the women's basketball player controversy with the racial injustices components to that. So that's a variable that I didn't think of as well. So thank you for that. I'll have to write those down.
Thank you. And if you could just repeat questions for us, that would really be helpful.
Yes, sir. Anything, again, I'm stumped on this one. Again, Dr. Hall and I were like, wait a second. And so I said, hey, I'm just going to ask the group tomorrow. I don't know. Again, to me, it's the transition. I don't know. It's what we wish we would have done now, and all in retrospect. We talked about it, would be to continue this same thing and do it this year, right? And see what we had at the beginning of this fall semester, if we had the same anxiety levels and what that looked like. Right? Yeah, so Dr. Cook mentioned about collecting a cohort in that Florida, and we were not able to do that because we were looking at a tighter turnaround. and his IRB turnaround is not as quick as ours. So we're, yeah, that's right. Yes, yeah, there you go. Exactly. Thank you, Dr. Cook. So it was just the turnaround, and also the access to students. Like, he wouldn't have been able to cast as broad of a net as we were here. He would have been able to do something around. Absolutely. Yeah, and that's why I was saying. What's that?
We are left to idly speculate.
Yes, yeah. So Dr. Cook's point was about being able to compare it to other institutions, and that's why I'm looking to see what other institutions have come out in this research. Again, originally it was those cross-sectional studies, and I haven't seen anything to come out for other ones too. So
could look at the effect of finals, right? Time 2 was around finals for the fall semester.
that's true.
So if there's a difference between those two, it might point more to something like Dr. Clint's talking about.
Yes. Yeah. You know, so Dr. Newton mentioned about the effect of finals. Time 2 should have been around the time of finals too. I think I tried to do it 2 weeks before that. I will tell you that, and so let me finish Dr. Newton's point here of if we compare time 2 to time 4, and that might be able to look at the effect of finals, and then maybe that would help us indicate other variables that were happening. And part of this, I think, is something that I'm not thinking of, like I'm missing, right? I had notes. I try to make notes. Hey, this is going on. This is going on. But since I wasn't doing the research in the spring of 20, my notes don't really have all those little details.
Yeah, just another thought, just look at the ranges for the earlier times, because perhaps the people who had higher levels of anxiety were more motivated to complete surveys in the all-rank times. You didn't have the lower anxiety folks sort of driving the average down.
Yeah. So Dr. Cook's point is just looking at the ranges to see if it was more motivation of answering the survey than actual anxiety. Is that correct? Yeah, that makes sense. Yeah. So like I said, it'll be interesting. We kind of talked through that on what to do next with those points. And again, just that jump between faculty and staff too was the part that kind of triggered me to look more about it and think harder about those things. So the other things that we are interested in, again, we're still playing with, we did look at gender differences. Females reported significantly higher anxiety scores at each point than their male counterparts. That was students, excuse me. And then faculty and staff only reported significantly higher anxiety scores at point 1 only. So again, if we're looking at maybe gender difference for that 0.4, everybody's going up. All right. And so faculty and staff were only different at 0.1. All right. This one was not surprising to me in the idea that females were reported doing those higher protective behaviors, avoidance behaviors of wearing their mask, sanitizing high touch points, and doing the social distancing component to all of those. And lastly, looking at the ability to perform, males, both students and faculty, actually reported that had a higher agreement, so on a Likert scale, that there was a negative impact on their ability to perform their job. So this is kind of that coping ability or lack thereof, again, within the construct of how we measure those things. Yes. So Dr. Newton mentioned about, I guess, women reported being more stressed, but men reported the stress affecting them and affecting their performance. Again, it goes to that coping. And there's one thing that we looked at here, excuse me, and Sarah reported, not sure you mentioned, I wonder if political-based tensions, vaccine testing, spring impacted anxiety levels. So again, those are all that mixture of things that is going into that. And can I tie that a little bit to, hey, we're in this safe university setting, and now I'm going to go away from this structure that I have. And now we're going to hear about more of these things, go home, whatever that might be. So thank you, Sarah, for that.
Sarah's point also, I think the end of spring semester 2020 was when there was a drop off in rates of vaccination. For the first time, supply exceeded demand at around that same time, and that's when it got polarized too. So that could be part of it.
Right, right. So Dr. Newton's point was talking about rates of vaccination and supply exceeding demand and what that all looks like. Again, so you mix all this basically unknown, right? We started this here, we've had our peak, and then we got through the spring semester, and now it's, oh, I have to go again. I have to go home now, back to whatever that situation might be. Politics, again, social structures, racial, social injustices coming out. So all of those things are probably playing part of all of that. So see it done. All right. So why is this significant and why are we interested in still talking about it and looking at it? Oh, the one thing I meant to mention here, going back to Taylor's point, and we didn't pull this out and that's why I didn't put it on here. We did note, and I don't know if we noted it was statistical significance or not, that females also reported having someone to talk to at higher rates. So having, again, that coping mechanism and living situations, again, that doesn't fall too far out of line of what we know around health issues and importance and the difference between the sexes. But again, how individuals use or cope with stressful events really kind of was interesting for this, although not surprising. I don't know if I should. Yeah, okay, I'll go with that. So why is this significant? One, because we know anxiety difference between groups exists. Okay, from faculty and staff, we looked at, we started it at mild, okay, and then we had an increase into that moderate level as we went on to 0.4. Again, my original thinking was, not knowing all of these other things were happening, of like, yeah, we'll get used to this. All right, we'll normalize this and we'll continue to do that. All right, and that didn't take place because, again, what I see is that spike at 0.4. Students started at moderate, moved down a little bit actually into what is mild, again around that 9, so still high, mild, and then jumped significantly to that severe. So for severe, it has to, what they say is over 15, right? So it's 5, 10, and then 15 on that score scale. All right. So there was that significant jump from mild to severe after starting the semester in this moderate category. So we know there are differences between groups. We know anxiety impacts performance. All right. So, and it also then, what we saw with quality of life, it impacts quality of life, which was measured by, again, the anxiety score, but also living conditions, ability to work at home, ability to do your work at work, so ability to perform in your job. There's difference in avoidance behaviors between groups. All right, so those behaviors, social distancing, wearing a mask, all the, again, the 3 W's is also part of all of this. And like I said, not only just having someone to talk to, but then also talking to them about those things these are significant components to all of our conclusions. So what can we do about it? I always want to try to do these action steps. First one that pops up, right, is talk about it. I know for me, it was like, man, we always talk about the COVID year, or at least I do. And it's like 2020, 21, in part of 20, start part of 21 from an academic year. It's like, wait, what happened? We actually did what? You know, and how did that work, or how it didn't work, or what was that like? You know, again, there's a lot of other components that go into 2020, and just realizing what the steps that took place. And again, putting on that timeline. For me, reading that timeline, it was like, oh, wow, yep, there was a lot of stuff that happened and we were reported on and trying to figure out. I know for us as public health instructors, trying to figure out how much to talk about COVID in our classes, but still have other topics to talk about because we had COVID fatigue, all right, at some point, but it's important, you know, and I think everybody had that. So it's, what do you talk about? What do you teach about it? When do you say about it? And then you go home and you talk about it, and then you probably dream about it. I know Dr. Lighting probably had a few of those. No, you didn't have any dreams about COVID. Okay, good. So it's all of those things that are components of that. Okay. The other thing is just the awareness. We all went through this. We all had this experience. Although our experiences are different, some of those anxiety and all that stuff is stuff that we all went through. All right. And the last one, and I think this really relates back to Dr. Newton's talk about messaging and communication, that we do, and I say we, public health does this, university does this in some constructs, we do just blanketed information, okay? Here's this communication, here's this information we need to get out, and we send it out to everybody, okay? Well, we need to do a better job of saying, we know these group differences take place, and this messaging needs to go out to this group, or for this group. It can still go out to everyone, but it might resonate more with one group because we know there's differences. All right, we need to do that with interventions, education, programming, etc. All right, it's that, hey, this is the assessment. We found out these groups are different, and now we need to be able to communicate with them differently to hopefully facilitate behavior changes to then reduce anxiety for better quality of life. All right, and so that's kind of the whole things that we can look for, things that actionable steps that we can do. One is, again, awareness that, yep, we did go through this. If we want to talk about it, it's okay to talk about it within the spaces that you feel comfortable. And then again, those targeted interventions for those group differences, because we know people are different. All right, we know people responded differently, and now we need to target those communications, target those educational strategies to those group differences, and not just blanket release information. I don't think I have anything else. Questions, comments, concerns? Checking the chat to make sure I didn't miss anybody. All right. I'll just ask a question of, what are thoughts on continuing? Like, is there a, I don't know, we missed the opportunity to do it this year, but COVID's not going anywhere. I don't want to surprise or raise more anxiety in anyone already, because it is close to the end of the semester, or it is the end of the semester, right? So maybe I shouldn't ask that right now, but is this something that, I don't know, I think we can almost repeat the same thing again, you know, or do it again, try to look at other institutions and see so we can apply there. Again, I'm not gonna be able to compare directly, but.
Randy, would there be any value, and I don't know if this could even be a valid thing to do. This is what happens when humanities professors start thinking about how we measure things with numbers. I found myself thinking that it would be really fascinating to see if there are ways to do quick surveys like this one as news is released about variants. So do we see in the student body a spike in anxiety as news about the Omicron strain is released in the news? What about faculty? How do those things follow each other? Because my guess would be you'd see a spike in anxiety in faculty first and then students, just because my students tend to be less aware of what's going on in the outside world than faculty maybe are.
Yeah, that's a good suggestion. The GAD 7 is quick. Obviously, it's just by name. It has 7 questions, right? So back to your point of doing quick surveys, I think our survey had a total of 26 questions, I believe, if you put all the demographics and all of that. So you might be able to, like a 10-question survey and put that out. I think uptake is always, in completion, is always problematic when we look at doing university things. I know, again, a protection that our university does is they don't like sending surveys out that compete with university surveys. So they have to collect so much data from our students on university things. I don't remember what those are called, but for SACS accreditation and other things, they don't want to over survey our population. So that's why there's some protection there. But I think that's something that we could definitely look at and discuss and see if we could send out quicker surveys or something like that. It's a good suggestion.
Do you think that there was a difference in students' experience of anxiety based on their majors? So I'm thinking of like students who take very lab heavy classes. Was the instructional difference between or the difference between typical instruction and actual instruction last year, is that part of what explains anxiety levels for students?
So Dr. Newton mentioned the anxiety level different by majors. And it's something we didn't look at. I've had trouble, and this is probably, we talked about early on putting a discipline question in there as demographic, because to say comparison between the College of Health Sciences and all others or whatever it would be to see if there's an awareness or just, again, clinical settings, et cetera. What I have found in the past of putting that in, students don't know what college they're in. And so it becomes almost too watered down and you can't really break that out. So I don't know. My thinking on that right now is I don't think there would be a difference because of the amount of information, good and bad, or wrong and right, or all of those combinations put together, that I think students more thought of it on that end rather than what they would have done on the academic side. Does that mean
like more anxiety coming from like general anxiety and the culture kind of feeding down rather than an individual's personal experience of this is what the pandemic's doing to me? Correct.
Yeah, that's what again, that's just my feeling on what I've seen, I guess, from a not seen in research scene, but just seen culturally, I guess, and socially. We did have a question too on, and I didn't put this in here again. We're trying to figure all out. We did put what year you are, so class year, because I think high school students coming to college would have a different, because they don't know college any different, right? Where we had this conversation in our COVID task force about our seniors this year are the only group that ever knew a normal college experience, right? And it's like, oh wow, that's, you're like, that's 3 years of, like, oh, okay. So looking at those different levels, I think would be interesting to see if seniors had more anxiety or less because they knew what it used to be like, where freshmen coming in from high school had a disruption, or maybe they had more anxiety because of the disruption. I don't know. That would be an interesting component to that. Again, something we haven't pulled out. Yeah.
Your service, like besides anxiety level, have you noticed certain kind of mental fatigue towards the pandemic because we've been doing this for more than a year or 2 years? And do you think like students become more like or less sensitive towards that, and somehow that helps to reduce their anxiety level?
Right. And so the question was about mental fatigue and COVID and the pandemic. And that's what, when we first put the survey together and kind of my thinking going into it is we would see a decrease of this anxiety level over time. And we did from 0.1 to 0.2 to 0.3. And then at 0.4, we had a large jump. And so that's what the question was when we were trying to think through of, okay, why did we jump at 0.4? What was going on in the spring, in April, around that point that caused the anxiety to jump? And there are some outside factors that could have done that, but there are also some internal factors at the university level that could have done that as well. So, but yeah, the mental fatigue, again, we're still talking about it, right? I mean, look, we're all in mask now. We all see this. I know when you go out to a social situation, you're like, watching the mask on, who's wearing masks, who's not, what does the signage say if you walk in, right? So I guess, I look at all those things. And so it's the presence of it is still there, which can cause those anxiety levels as well. So does that address what you were talking about? Yep. Anything else? On scroll down, make sure I didn't. All right. Well, thank you very much for your time this morning. Devin, thank you for setting all this up. Dr. Fisher, thank you for setting all this up. Dr. Newton, thank you for the invite. And the rest of you, thank you for being here and listening to the research and providing your feedback.